in the 29th episodes of Phatak Materia Medica Series, the remedy Amyl Nitrosum. Amyl Nitrosum is the day-to-day useful remedy in the homeopathic practice. So let us understand or decode the Amyl Nitrosum. So Amyl Nitrosum is the primarily Dr. Phatak says vaso-motor remedy. It acts on the vasomotor nerves, arterioles, capillaries, especially cerebral and cardiac circulation. Its action on cerebral and cardiac circulation. So, due to this remedy, sudden dilatation of blood vessels, sudden flushing, heat, throbbing, followed by weakness, sweating, and anxiety. This is not a slow pathology, it is a sudden, explosive, dramatic circulation disturbance. Phatak highlights it as a flushing heats, throbbing head, palpitation, anxiety, desire for fresh air. Clinically, this remedy is fast, violent, short acting, and emotion triggered. This is why it because it's extremely important in the day-to-day practice. So, this patient lies in the overreaction, no imagination reaction. Small stimuli, big response. Silent emotion, silent excitement, silent heat, silent crowd, and suddenly face flushes, heart pounds, head throbs, and anxiety explodes. They cannot sit still. They feel better when moving and walking and going outside. Loss of vascular control with emotional trigger. Menopause, exam stress, grief, panic like episodes, public speaking anxiety, post delivery collapse, all are flushing and palpitation. So, amyl nitrate patient don't feel sick slowly, they attacked by suddenly. So, key mental features of amyl nitrosum is anxiety as if something might happen, must have fresh air, cannot sit still. Emotional excitement aggravates. This is not this is not imagination like argentum nitricum. This is a vascular anxiety. Emotional causes are emotions, grief, climacteric phase. Menopausal phase is the very important for this remedy. Exophthalmic goiter from grief, climacteric phase flushing with anxiety and palpitation. This remedy has strong role where emotion circulation symptoms start. This remedy is not a hysterical drama. This is a physiological gone out of control. So, physical generals of amyl nitrate is thermal state of this patient. This patient is hot, cannot tolerate heat. Wo- Aggravation in close, crowded rooms, wants open air immediately. Relief from cold water, fresh air, and movement. So, patient may say that, doctor, please open the window. I feel suffocated. Think of amyl nitrate, carbovage. Sweating, very important point that Phatak describes us as flushing heat, followed by drenching sweat. Sometimes unilateral sweating. This is sudden heat, sudden flushing, then sweating, and then weakness. This is not a chronic sweat. This is a vasomotor sweat. This is due to the increase of cortisol levels. Energy cannot sit still, walks about for relief, tottering gait, inclined to fail on the one side, weak, emaciated looks anxious, unstable, but not mentally confused. Sleep, yawing, and stretching is very characteristic. Dr. Phatak says that profound repeated yawing, is the characteristic of this remedy. Constant stretching, stretching with hiccup, yawing even in coma. Yawing even in coma. This is a very important concomitant symptom for this remedy. Patient yawns continuously during consultation. Says that I feel satisfied unless I stretch again and again. Peculiar symptoms, head symptoms, surging of the blood to the head, throbbing headache, fiery red face, sometimes migraine with pallor. Head symptoms are due to vascular, not a neurological. Face, easy flushing on slightest emotion, blushing without cause, chewing motion of the lower jaw, smashing of the lips as if tasting. So these small automatic movements tells you that nervous system with circulation involvement. Throat choking sensation, collar feels too tight. This is often mistake from anxiety disorder. This is a vaso-motor spasm. In stomach symptoms, hiccup, yawing and stretching. Don't ignore these small symptoms. They gives the entry point to the prescription. In female, a very important remedy in climacteric age or menopausal age, climacteric flushing, headache, anxiety, palpitation, menstrual neuralgia, hemorrhages with flushing, convulsions immediately after delivery. Chest and heart symptoms is the core of the amyl nitrosum. Dr. Phatak says that it is a cardiovascular remedy. A violent palpitation, fluttering of the heart on slightest excitement, angina pectoris with great anxiety, pain and constriction around the heart, full full soft pulse. So in heart and respiratory symptoms, pain plus anxiety plus flushing plus excitement. Think of amyl nitrosum. In modern day-to-day practice, you may see the patients of panic attack, menopausal syndrome, vasomotor instability, angina-like pain with normal reports or normal angiography, but violent palpitation, hypothyroid-like symptom, especially exophthalmic goiter, post-influenza weakness with abnormal sweating. This is a functional circulation disorder, not a structural damage. So, prescribing totality for the amyl nitrosum is sudden flushing, palpitation with anxiety, aggravation from emotion, better from open air, cannot sit still, yawing and stretching, throbbing throbbing in head and heart. These 5 to 6 points are clearly matches think of amyl nitrosum. When circulation reacts faster than the mind, amyl nitrosum enters there. So, when patients, we have to confirm the amyl nitrosum. What happens first, emotion or palpitation? If emotion triggers the circulation, amyl nitrosum indicate clearly. So, the core of the amyl nitrosum is flushing, palpitation, and desire for fresh air. So let us differentiate the remedies which are related to the amyl nitrosum. First remedy we will think of is gloninum. So amyl nitrosum has anxiety, need for fresh air, emotion triggers the symptom, while gloninum has confusion, stupor, loss of control, sudden heat congestion are primary. In physical level, amyl nitrosum has palpitation, flushing, and anxiety better in the open air, while gloninum has violent headache, bursting sunstroke, aggravation from heat, better from cold application. So, when emotion starts the attack, think of amyl nitrosum. If heat, sun causes the cerebral congestion, think of gloninum. Another remedy which is very nearer to is lachesis. Amyl nitrosum has anxiety, fear, something will happen, wants air, wants movements. Lachesis has jealousy, loquacity, suspiciousness, night aggravation, cannot tolerate contradiction. In physical level, amyl nitrosum has sudden flushing, palpitation, and sweating, while lachesis has left-sided complaints, aggravation after sleep, tight clothes, aggravation. So, in flushing is vascular and sudden, think of amyl nitrosum. If flushing is toxic, left-sided and talkative, then think of lachesis. Another remedy which is nearer to the amyl nitrosum is argentum nitricum. So, amyl nitrosum has anxiety from circulation changes, while argentum nitricum has anxiety from anticipation and imagination. In physical level, argentum nitricum has diarrhea, flatulence, and trembling, while amyl nitrosum has flushing, palpitation, and throbbing. So, blood vessel panic, think of amyl nitrosum. If mind panics, think of argentum nitricum. As Dr. Phatak described as a complementary remedy is glonine and lachesis. So, glonine has acute congestive phase, amyl nitrosum has acute vaso-motor storm, lachesis has chronic climacteric toxicity, cactus has fixed constriction of the heart, aconite has sudden fear with shock. So, glonine, congestion is glonine, flushing with palpitation is amyl nitrosum, with and chronic climacteric issues is lachesis. Potencies, we may think of lower potency 6 and 30 potency. In some patients who get sudden unconscious, or patients who have acute attack of asthma or severe blood pressure, unconscious due to this, uh, I will use the amyl nitricum mother tincture to smell them that mother tincture. This mother tincture is must be kept very close or tight bottles. So this mother tincture used in emergency situation, and 6 and 30 potency are used to overact with other conditions. So when we remember the amyl nitrosum, think of flushing, palpitation, air hanger. These are the entry point of amyl nitrosum. So emotion pulls the trigger of blood vessel, fire, and the shot, the think of amyl nitrosum. In his like Materia Medica. So thank you for patience listening. Thank you. We will see in the next episode. Thank you very much.